Hey guys, my name is Mari. I've been a nurse for approximately 4 years. I'm currently employed in the cardiac cath lab. I don't think it's affected too much the cardiac cath lab since it's a specialty. We usually can control how many people are in at a time and how many people are out. But it has affected bed situations, getting beds for these patients that need a bed to stay with the night. We've had to stay with them up until 10, 11, 12 o'clock at night. And this area is a place where it's not like you're working 312s and you're off for 4 days. You're essentially on Monday through Thursday or Monday through Friday, 8 to 3:30, but you're most of the time staying above that time. It's definitely affected getting beds, which has always been a problem, but post-COVID, it's been a bigger problem as well. I don't think so, especially post-COVID. So just to give you a little example, our ICU at the hospital I work in had 15 new grad hires, not just 15 RN hires, 15 new grad hires, which is essentially enough to staff the day and the night shift. And there's nothing wrong with that, assuming there's plenty of staff beforehand to be able to train those nurses. I think it puts a damper on things. It may put patient care on the back burner a little bit just because there's so many new nurses out and about on that particular shift where things might not be seen as early. Things might happen without them knowing. I don't think they're being treated fairly, unfortunately, and transitioning to a hospital setting or a post-college setting. So besides the first 3 months of orientation as a new grad, I genuinely don't think I've ever had a point in time where I felt not burnout. It's been quite the run. This past year has probably been the most difficult year in terms of nursing. You kind of expected things to change for the better for nurses or healthcare workers with COVID, and unfortunately it just got maybe 10 to 20 times worse instead. You have more shortages. You're working understaffed essentially 100% of the time. And there's no actual compensation for it other than your typical pizza party.
My name is Tracy. I am a clinical supervisor. I work in pediatrics, almost 27 years. Obviously, if nurses are stretched and thinned out, they're not going to give, the best care that they could give because they are pulled in so many different directions. I think when you're like a new nurse, you're like very excited about what you're going to be doing and stuff like that. And then when you come onto a unit, everybody else is more stressed out and kind of jaded and like already like overwhelmed all the time. And I think when you're a new nurse, it kind of ruins your joy of the nursing field. Yeah. Not right away, but over time.
Angela Desgupta. I'm the Director of Nursing at a SNF, which is a skilled nursing facility, or facility period. A good staffing ratio, day shift would be 1 staff member to 5. Afternoons, or actually, that would be a great ratio. But day shift maybe 1 to 8, afternoons 1 to 10, midnights 1 to 12. Pretty much, we're probably actually a little better. We unfortunately have to utilize agency, but it still ensures that we have the proper amount of staff. We just had to find strategic ways of ensuring that they still got the care they needed. For example, we have utilized our dietary staff to assist, trained, of course, assist with feedings, management staff, assist with housekeeping needs. Everybody's a senior now, so we, kind of all have to pitch in. So we try to ensure that patients still get the care they need. We just provide it in a way that all hands on deck now. Patient care issues because of the short staff, because again, we literally do overtime. We have looked at the assignment, especially with COVID. We've looked at the assignment and pretty much look at management and say, okay, what floor are you going to? Because we might only have two. At one point, we had 2 staff members on the board. So guess what? Everybody is going to work. So, during COVID, you have management that work 11 days in a row. Just what you have to do. That's the field we took. The old saying is nurses eat their own, eat their young. Not true under my watch. We all were new at one point. So I definitely think it's very important for anyone in management field, any nurse, to ensure that we train our new RNs coming on the right way. Train them right. You don't have to worry about them messing up later. Yes, I think as a director, definitely go through those periods of burnout when you have survey in-house, shortage of staff, have their own issues. So being a good supervisor, sometimes you have to put yourself on the back burner. You have to do a little more to ease your staff. Staff might need a day off just because of their burnout. And you do have to step in. I handle it a lot of times like a lot of people. We go home and we cry, and you get up and you come back and you start over, new day. Patients need you. It's the team, the team, the team. Everybody must join together. If they're short in the kitchen, guess what? They're not short anymore because we're going in there and getting on the line, making sure patients get their food. Turnover rate, we're probably at about 60% or so. We got a real high turnover rate. A lot of the nurses are leaving now to go to the pool. So they're taking assignments in other states, rural areas, just where they are, making, RNs are making 95, 65, 95, 120 an hour. We can't compete. You're not supposed to take work home. You're not supposed to take home to work. It doesn't always work like that, because the problems don't leave. They're still there. You just have to manage them and make sure that, yes, I go home and I still have work at home with me. So it's not really a juggle for me. It's like I got it in a mixing bowl. It's all one.
Nursing staff retention and the effects it has on quality of patient care.
Prior to any interventions, institutions may lose up to $10,000 to $88,000 for nurses quitting in the hospital. Quality of care to the clients are gonna decrease due to the shortage of the nursing staff.
The outcome that we're looking for with nurse retention is to reduce financial burden on institutions, reduce errors in medical practice, reduce patient wounds, reduce falls, and increase the quality of patient care within a year.
Our interventions include increasing nursing knowledge and skills by increasing their training, which will help to reduce stress and promote satisfaction of newly hired nurses.
Is a lack of knowledge and skills leads to unrealistic expectations and dissatisfaction by the newly hired nurse unless action is taken to bridge the gap.
And leaders offer a supportive environment by providing resources to address incivility and bullying to ensure a positive transition into the work culture and serve as a transformational leader.
So post-intervention, nurses will be retained, and that will increase quality of patient care and reduce institutional loss of costly training.